My name is Bianca Jordan. I work with the National eHealth Transition Authority, and I'm a mother of two. I've got a very busy toddler who's hopefully sleeping for my husband and a kindergartner. So I understand the pressures of trying to balance the work, looking after your children, sometimes having some personal time. And one of our biggest priorities is the health and well-being of our children. But it's also one of our challenges to remember all the information, what medication we gave them. And especially when they're sick, that's when it gets really scary, trying to remember everything about them. So what the Australian government has done is they're starting to create an electronic health record for all Australians. So from 1 July, people can register their children and themselves for this electronic health record to help connect that information and give you a place to remember all that information. I'm sure most of you have got the blue books, and whenever you get to the doctor, you're like, oh, I forgot my blue book. You'll be able to keep the key information that would be in your blue book in the electronic health record, and in time we'll have the iPhone app and the iPad app, so you'll be able to keep it easily with you. So for the next 20 minutes, I'm going to talk to you a bit about what is this eHealth record, why it's good for you and your children, and then importantly how you can get one from July when the system's available. So in general, in an average year, every Australian will see a GP 4 times, go to a specialist 3 times, see an allied health professional twice. You'll go get medication for your baby or your child or yourself 12 times. And every piece of this information is stored in different databases on paper records all over the country, and none of it's connected. So if you do land up in an emergency situation, doctors and the people caring for you don't have access to that information, and you don't have access to that information. So the Australian government, to help combat this and to help put the right information at the point where people need it to look after you and your baby, they're going to be creating an electronic health record. When we interviewed a mother, Alex Sullivan, of 2, she said having an eHealth record will provide her more connected healthcare for her and her family, so that no matter where her healthcare professionals she visits and where they visit her, they can all have access to the same healthcare information. So what will this mean? This health record is aimed to improve and make the healthcare system work better, more safely and more efficiently for all Australians. And it'll help our doctors take the best possible care of ourselves and our babies. What's in this health record? There's going to be a shared health summary which gives a snapshot of the key information about your child's health, especially for children who aren't so well. Doctors will be able to put the key information about the baby's health and their medication. When you go see an allied health professional or a specialist, they'll be able to put other information about that event into the record. If you've been in hospital, there'd be a summary of your hospital discharge information. And the most important section for mothers will be the consumer-entered health information section, where you'll be able to capture their allergies, their feeding information, their weight growth, and you'll also be able to get easy access to selected Medicare data without having to go onto the Medicare website. As I said earlier on, this is different from what's currently available. Different information at the moment is stored differently. It's on paper. You as the mother don't have access to your child's information. Through this system, you'll have access to that important information, and you'll be able to capture some personal notes and personal information about your child. So the benefits, why should you try and get one? Why moving forward? You'll be able to control your baby's health information. You'll be able to access it securely online, just like your bank account. You'll have a password and an access identity. You'll be able to save potentially life-saving information in there, their allergies to nuts, their allergies to medication. That information is available anywhere online at the point that you're being treated, and it'll help you build up a growing evidence of your baby's history over time. And you'll also be able to get others to help you manage this information. You'll be able to nominate other carers to look after them. There's a picture of what the system is looking like. We're busy working with the final designs of the system. As you can see on the front page, you'll be able to access your health record as well as your children's health records. And when you move into the system, there'll be a consolidated view of all your baby's key health information, including their medications. So, the two big questions we get asked by people about their health record is it secure, and will I know how to use it? To answer those, yes, it is secure. The government is putting in place a lot of technology controls and legislation to protect you and your children. You'll have a secure login and password to get access to the system. And importantly, you'll be able to control which organizations access the record if you choose. And you'll be able to help your children manage their health information until the age of 14. And if they choose at that point, they could start looking after their own electronic health record. You'll be able to know what to do with the system because we're going to have some training and some online tools to help you use the information. This is our learning centre, which will be available shortly at ehealth.gov.au, and it'll take you through how to create a record and how to use the record for the best outcomes for your children. So, from the 1st of July, you'll be able to create a record for yourself and your children, either by calling the number 1-800-723-471, or by going into a Medicare office, and they can assist you in creating a health record for your children. And in time, you'll also be able to create these records online. And once your record is created, either through having called the phone number or by going online, you'll be able to access your record anytime, anywhere from any internet service. Over time, when the online registration is available, it's quite it's a 3-step process where you'll have to register your child and yourself. You have to prove who you are so that there's no confusion about the identity of you and your baby. And then you create this record with all the key information in it. And as I said, the website is ehealth.gov.au. And the big vision is that over time, this information will grow, access to the information will grow, and that when you go see a health provider, they'll be able to look after your children, having the access to the right information at the point where they're being looked after. Any questions? Thank you.